At this point, you guys might be wondering where actually is Phanat Nikhom. Phanat Nikhom is a municipality in Thanaree which is located in eastern North Thailand, with around 10,000 people in 2.76 square kilometers. Phanat Nikhom is well known for their cleanliness of the city. Waste management system is one of the good examples that many cities try to follow about cleanliness and management. This leads to the new strategy of Phanat Nikhom as sustainable living municipality. As to follow the Phanat Nikhom strategy number 2.3, which is about encouraging the health and well-being of people in Phanat Nikhom. They provided universal design public parks, green public space, and outdoor one-stop health service. Can you guess how many universal designs in Phanat Nikhom? There are actually 5 parks in total, and 2 of them are sports centers. First, สวนสาธารณะเมืองมนัสนิคม Second, สวนเฉลิมพระเกียรติสมเด็จพระเทพรัตนราชสุดา Third, สนามกีฬาเทศบาล Fourth, สวนสาธารณะชุมชนเทศบาล 6 Fifth, สวนสาธารณะชุมชนเทศบาล 9 From the statistics, 18.97% are elderly, with some are bedridden and vulnerable. Many teens or workers tend to thrive in more economical cities like Lam Chabang, since there are many factories and companies to work with rather than Phanat Nikhom. With the higher elderly number in the city, leads Phanat Nikhom to become an aging society soon. To serve the situation, healthcare service will play an important role in Phanat Nikhom. Currently, the health service in Phanat Nikhom uses the traditional disciplines as the government, which some of information is based on paper and placed separately. With this method, the data won't be up to date, and it is hard for gathering from each department. So, when the new event that requires health data from citizens, they have to fill in the form or record a physical examination over and over. For example, COVID-19 situation, the government provides many services, where 90% of them are applications such as Moprom, Moshana, and many more. All of them require new registration from users. It is clear that the applications and the collected data are not used in an effective and efficient way. That's why the citizens have to repeatedly fill in the form that have the same questions. Furthermore, patient-centric is also one point to concern. From those, it shows the pain point of current operation in data management in the health field. However, there are many techniques and procedures that will change the current situation to become a smart health system. But wait, before we go further on the solution for smart health in Phanat Nikhom, let's talk about its definition first. Smart healthcare, from our view, uses technology such as automated things. It enhances the services to become much more specified and for long-term purposes. It turns to be more public and accessible that affects people's lives in almost every aspect. It is possible for citizens to have a better quality life. There are significant changes in medical model. Smart healthcare mainly pays attention to patient centers rather than disease centers. It is not the idea of fixing only current problems or disease, instead looking at the whole picture whether everything is functioning normally. Information system in health is also modified. It now seamlessly passes the data from one place to another place. It used to be hard to access the data and information of certain patients. However, now they can be gathered and connected in one place. Lastly, treatment mindset differs from previous. We are aiming to catch prevention, not responding anymore. All in all, the structure will be flexible and customizable. A plan will be customized based on data information and patients themselves, so that they can get sustainable healthcare. This service will be more efficient and convenient for all stakeholders. So let's come back to compare with the current health service in Phanat Nikhom. Phanat Nikhom has three main traditional ways to collect health data. The first one is a health checkup at the hospital. This process will collect the patient health data every time they come to the hospital, beginning with registration and then the basic medical checkup. The second way for health data collection is to fill in the healthcare survey. This process allows people to update their health information anywhere at any time by themselves on the authority website. Lastly, the health information can be gathered based on governmental activities such as the military service selections or blood donation. We can see the problem very clear from the current process flow. The data in the system is not up to date and no fixed schedule for data collection. After the data is collected into the system, citizens need still to fill in the form anyway. Why? Because currently the data is stored separately. There is no main place for storing and sharing the data to every department. Moreover, the data is based on both online and paper form. This is the reason why the data is still not accessible in some cases. So, how we restructure the traditional operation of health data management in Phanat Nikhom to be smarter, more effective, more efficient, as a smart health. Let's start with the data based on the system. Currently, the legacy data and the health data are placed separately and unlinked, such as the registration data, the house registration, the medical condition data. We will start the reforming the data stored. All of the data must be placed and linked on the cloud system by using citizen ID number as a medium between all data. If you cannot imagine how it works, here's an example. Referring to the COVID-19 situation, there are 5 people living in the same house, and if one of them got infected, everyone in the same house or the nearby house would be high-risk contact. If the personal information is linked with the house registration data, it would be easier to contact the high-risk case and control the pandemic in those areas. Moreover, if some of the high-risk cases have a medical condition, they will be specially watched for symptoms. Moving on to the data collection process, we aim to integrate the technology with the city landmark as it is accessible for everyone at every age and gender. We will put data collector kiosks at the park so it is accessible for everybody at every time. This will be improved health services within the park. Citizens will always be able to update their health data and store it on cloud for their own benefit in the future. However, to motivate the citizens to update their data at least once a month, there will be a charge fee for anyone who has no update in the previous month and joins the health event that needs basic data. The data from kiosks will be uploaded on the cloud server and accessible by every department. The basic health data will be collected and ready to use, so won't be wasting your time to fill in the form anymore. First, we are going to implement body composition to the park. The records most of the data is not available in the system so far. We gain weight, age, muscle mass, fat mass, and amount of nutrients in the body, such as water and minerals. We can use these data to generate information like BMI and fat percentage. Of course, calculating only BMI and fat percentage is not smart enough, so segmental lean and fat are also can be analyzed. When we get the data and information, we can come up with a plan to encourage people to do more exercise. Improving health performance of citizens will be another goal. Exercise machines are already located at the Province Sports Center in Phanat Nikhom. We see the opportunity in the health if we implement the sensor into them. The most essential data from this sensor will be heart rate. It shows the presence of the users and the condition of the machine. Use rate of the machine, which can infer to the use rate of the park, can be received. Moreover, it is interesting that we can know the number of incidents and breakdowns of the machine. and prediction of usage demand by tracking these sensors. Maybe some of you might be curious why we need this information and data. The reason is to plan for park improvement, control, and expansion. Physical and mental are major factors encouraging people to continue to exercise. These days, mental health also plays a big role in our life. This is the reason for using the emotional recognition. This sensor will be used to lead users to the goal. Monitoring and analyzing will be combined together to enhance users' experience. Preventing and avoiding to get bored and no motivation to work out is our main aim. We realize that it is better if we can get the data from everywhere besides hospital. Data collector kiosk would be one of our choices, as it is portable and functional. Users come to kiosk and receive the basic health checkup and many more. All information can be used for medication and prevention purposes. Analyzing the risk of specific disease can possibly be diagnosed, such as diabetes and hypertension. We will apply facial recognition and analysis as sensing technology by using the image processing camera. The role of the device is to make the process more convenient for the citizens who are using the kiosk. The image processing camera will capture the user's face to identify and recognize the user, so the user doesn't need to fill out their general information. Edge computing used for summarizing user faces and preventing from duplicating the data and facial recognition. For example, only keep track of person A only when he starts to use the kiosk. Then, the facial recognition will be sent through Hadoop and stored on the cloud. And then, the data will be able to use in many more fields. The sensor will automatically detect the face and collect the data without manual checking. Making use of the CCTV camera leads to a huge difference. It can be used for pandemic control as right now, we are suffering from COVID-19. For example, people whose temperature exceeds 37.5 will be restricted. This camera isn't just for temperature checking, but it's also for park and machine extension plans. We will implement and utilize the technology in the park for gathering and integrating data from the citizens. After the implementation of the improvement plan, the citizen can register their health data through the machine and sensors. All of the data will be collected on the city cloud system, with the legacy data that was collected from the previous. To be more clear, let's go back to the example of COVID-19 situation. The government provides many services where 90% of them are applications such as Moprom, Moshana, and many more. The user will need to fill only the citizen ID number. They can reduce the time and the process for data collection, and related authority can access and utilize the data more effectively and efficiently. Moreover, the data will show the rates and the statistics of citizen health and encourage the related departments to use it. For example, the government can use the data health policy or health service plan improvement that suits specific citizen health. The data will be used for park improvement and management to calculate the demand and supply in the park, to collect the feedback from users, and to control the pandemic. Besides, the data can be used in many other aspects of health fields such as the hospitals, the clinic, the pandemic control, and many more. In order to become a smart city, automation in fundamental information usage is required. Smart health takes us to another level of better life quality. Repeatedly actions are prohibited.